you a woman in medicine feeling overwhelmed and disconnected from the personal fulfillment that you desire? You're in the right place. Join Doctors Joanne and Erin as they rewrite the rules for women in medicine. Let's begin.
You can be the most accomplished woman in the room and still be completely alone in your struggle. That ends when you find your people. My co host, Dr. Erin Hurley, has been doing exactly that. She has been saying yes to powerful rooms, powerful people, and powerful experiences. And today I get to ask her all about it. Before we dive in, if you're listening in Apple Podcasts and you haven't yet, we would really appreciate if you click on Go to Show, scroll down, and give us an honest rating and review. Remember, this is how we really know what you want, what you need, and that's how we create the best content for you. So, back to this important message. Erin, let's dig in. And before we started recording, we were talking about what's been going on, and I was listening to all the amazing things that Erin has been doing. And you recently sat in the theater for Suck It Up Buttercup documentary and its screening. Tell us about that experience. Why did you decide to show up for it? And what did it bring up for you?
Well, as you know, Joanne, we have interviewed Dr. Todd Otten not once but twice, and he's one of the executive producers behind this film. And I had learned enough about it, and my interest was piqued when he's talking about being a physician disruptor and not being okay with the status quo. And as a physician, and with our listener having so many physicians and healthcare providers in it, we know the medical system is quite broken in most areas of the country and just seems to be getting worse and worse. And this kind of pulls the curtains back on some of the behind the scenes things that are going on, whether it's insurance coverage, denials, prior authorizations, all kinds of things that are really getting in the way of some of the success that we can have as physicians, and things that are just creating heavier burdens in an already complex time. And the documentary did not disappoint. They interviewed a total of about 50 individuals, from physicians and healthcare providers to Mark Cuban, about the financial pieces behind medicine, the delivery of care behind medicine, again, insurance practices. It really kind of shone off a bright light on some of the areas of medicine that are not always talked about. And not all of those 50 interviews made it into the documentary, or the editor said it might have been like 3+ hours long. And yet it was compelling. The stories were compelling. They interviewed real people about their experiences, and really helps give a clear picture, whether you're a healthcare provider or on a healthcare team, or you're a patient experiencing what it's like to maneuver through medicine. And I'm so glad that I made the trip to Baltimore and saw the documentary and got to meet in person. I gave Dr. Todd Otten his first real hug between you and I, Joanne. So sorry about that. But it was great to meet him and many members of the team in person, and then also offer to support them bringing that showing hopefully to the Northwest. More to come.
Wow, talk about showing up for yourself and for others in this community, and being in the right rooms that create that change that we want to see. And Erin, before I ask you the next question I had for you, for those who might be curious, how would you define physician disruptor for yourself?
Someone who is not okay with the status quo. And in my coaching program, if you work in medicine, you are probably familiar with the term. If you hear hoofbeats, think horses, not zebras, because common things are common. So you have a sore throat, you probably have strep or a virus, you probably don't have throat cancer or some rare condition. So you think horse is not something obscure like a zebra when you hear hoofbeats. In my coaching program, I talk about creating unicorns or becoming a unicorn. So common outcomes in medicine, like horses, although I love horses, the common outcomes in medicine are pretty abysmal, between the high burnout rates, the high issues with mental health problems, the high suicide rates, the high turnover rates, the lack of job satisfaction, all of those things, I call those horse outcomes, very typical and not desired. Maybe you're doing better than average, and that would be a zebra. And I talk about unicorns are the ones who are getting completely non-traditional results, who are combating fatigue, exhaustion, overwhelm, and burnout, who are having joy and thriving at their medical careers, not dread and overwhelm. And so it's one of those things where the status quo is not serving the healthcare providers and their teams, nor is it supporting most patients on their care journeys. And the status quo is not acceptable. It's just creating many bad outcomes. And so being a physician disruptor is what's going on, raising awareness, and then taking action to disrupt it and do something about it, creating solutions.
I love that definition because I think with that doctor programming that we have, that we're trained and modeled into staying in our lane, checking off boxes, doing the right thing. And then sometimes we think of these disruptors as kind of like the bad kid, right? Or that's what comes to my mind. And I love how you said it because it's actually the opposite of then saying we are in this unicorn positions of opportunity of leading and coaching. And then it's really questioning, going deeper to then say, and what else? And can we go upstream to create a bigger change? And then do we always, or do we also kind of go to the person and see how we can create change? So I love it when you talk about your coaching program and the people that you've helped become unicorns themselves. And then that's a beautiful ripple effect that this work creates. So good. And talking about ripple effects and talking about creating big change, you also attended the Lorna Breen Heroes Foundation Physician Leadership Conference recently. And for anyone who doesn't know that organization, tell us why it matters and why being in that room was important to you personally.
We're talking a lot in this episode about connection. So, the reason I even know about the Dr. Lorna Breen Heroes Foundation is through Kim Downey, who we've interviewed on this podcast several times before. She is an absolute super connector, and you can't help but find more physician disruptors and amazing human beings if you are connected with Kim Downey. And she posted about this physician leadership conference last year. I didn't really know anything about the Dr. Lorna Breen Heroes Foundation at the time. And I trusted my gut and I said yes to going to the conference, meeting Kim Downey in person, and was blown away by what this organization, this nonprofit has done in such a short time, based on a very tragic incident where Dr. Lorna Breen was an emergency physician who died by suicide during the pandemic 2020, partly because of the resistance to seek mental health support because she thought it would impact her ability to stay as a licensed physician. And from that, her sister and brother-in-law, and the brother-in-law's Corey Feist, who we have interviewed on this show back in episode 133, started the Dr. Lorna Breen Heroes Foundation to do many things. One is decrease barriers to healthcare providers seeking mental health, and also being disruptors and making my own words is kind of making medicine a less toxic place to practice in, not just for physicians, but for the healthcare provider teams. And they've got very robust services. I can't believe how many amazing programs that they have started in order to make things better. And so this physician leadership conference is a mix of individuals who also want to get behind the movement and create sustainable changes. And at the conference I was at just earlier this week, really they highlighted individuals and organizations, including an organization that had a budget of zero, and the amount of change they made happen. Even with they likened it to, is it Apollo 13, where they were stuck in outer space and they had a big problem about getting home, and they dumped all the pieces and they said, this is what we have to work with. This is what they have on the spacecraft. And I might be misquoting things. I've watched the movie, but it's been a while. But they basically said they have only these things that are already in the organization. How can we create a robust wellness program? How can we better support our team? And I get goosebumps just thinking about how much change they were able to implement even without any extra budget. I was so inspired by them. And being in that room, hearing success stories, when you can look around and just see disaster everywhere, we have to have hope if we're going to think that we can be a disruptor, if we're going to think that change can happen. And so being in that room this year was intentional. I'd been there last year and was so inspired and so hopeful about what I learned about at with the outcome after this tragic loss of life, that I want to continue my relationship with this organization. I became an ambassador, and which just means I help support awareness, fundraising. It's a nonprofit, and help bring others to the table so that they are aware of this organization and the very strategic actions they are taking to make medicine a better place to practice in, and also to have better outcomes for the ultimate goal, which is quality patient care.
This is so important. Thank you for bringing this up, because I'm always trying to think of what is our listener thinking when they hear us talk about all these things. And I know, and I've been on that side where I hear all these amazing things, and I can think of, well, I don't have time for that, or I don't have the resources, or that's easy for you because you're in that space. And I want to challenge our listener to say, especially what you're saying of, you can create so much change even without the big resources, if you really want to, if you're in the right room, if you mobilize what you have and leverage, and that it's a responsibility that we need to take. This is no longer like a cute retreat to go have fun. These are important things that we need for our own well-being, as well as for the bigger picture. So I got all like passionate here about this, because I Erin and I do so many things, and we do so much for our personal growth, and also in what ways we can give back and help. And I am going to brag on Erin, because she is someone who walks her talk. It's beside what we were just saying of how she's involved in this organizations and foundations and supporting, but then also her years of coaching and leading in medicine, and really being on top of her game, what's going on, creating changes so that she can bring the best to her coaching clients and to her community, and then creating even different things, as going to a writing retreat, something that we don't think of in terms of physicians, because that's a beautiful way for us to communicate and connect and create healing. And then we talked about this also, and I'm gonna probably say it wrong, but the writing the cards that then we can also gift for doctors. And remind me of the initial
Notes from the
organization
heart.
for this.
Oh,
Thank you.
so the Marion Polk County Medical Society, I'm the president of the board on that society, and we are doing our second annual Notes from the Heart event in just a few days, and we had a episode that released on that just last week, and it was like an easy lift. I'm really good at event planning, and being able to pull it off the second year in a row was because I heard how much of a benefit, and that the ripple effect was still occurring almost a year later with one of the physicians that was nominated to be acknowledged by his patient at the first one. And again, getting affirmation from another medical director in another organization, a statewide organization, Oregon Wellness Program, saying how impactful it was for her to attend the year prior. And I thought, okay, that's the universe saying this has got to happen. And now we're having the second annual one. Actually, this morning I was late getting ready for the podcast because we're partnering with the Salem Public Market, just great individuals, and getting donations for a fundraiser for the Oregon Wellness Program, which provides free mental health services for physicians, nurses, PAs, and NPs. And it's this ripple effect of people wanting to lean in. And it came from a simple idea about writing a card to a healthcare provider to say thank you. That's, and that's something each one of us can do on our own. We don't need an event. We don't have to overcomplicate it, which we often do as women in medicine.
Yes. See, I'm the luckiest that Erin is my buddy and my partner in all of this. And it's a beautiful example that we're talking about this foundations and the documentary, and it sounds so big, and then bring it back to, and what can I do locally? What can I do with just a few other people? Or if you're not the one who wants to plan, it might not be easy for you. You can also see who else is doing the thing and then just join them and support them. So we cannot just stay with our arms crossed. And talking about that, Erin, for are women listening who are craving this kind of connection? But again, like we were saying, keep on talking themselves out of it. What would you say to them? And also, what is the cost of staying out of the room?
I ask my clients that question about what is the cost of not doing something. I can, from my own experience, what would have the cost been if I never said yes to my first coach? I wouldn't have met Joanne back in 2020. My marriage would not be as strong as it is. I wouldn't be the parent I was. And that was because I said yes to something completely new, completely different, and I took a chance on myself. I decided I was going to gift myself for my 50th birthday the gift of coaching. And that one decision created this ripple effect in my life that 9 years later, I'm still feeling it, because 10 years ago, the me never would have seen myself where I'm at now. But that one kind of fateful decision created a ripple effect. And when you keep telling yourself no, then there is a cost. And or even not making a decision. Sometimes we say, well, I'm going to put myself off. Let me look at this in 6 months, 12 months, 18 months, 2 years. And I've seen that happen with women in medicine that just keep putting themselves last. So there is a cost to not putting yourself first. And I think the biggest cost is lack of sustainability. And if you ask yourself, what if my life didn't change one bit? Where will I be in 6 months, 12 months, 5 years, 10 years? Can I sustain? And if the answer is no, then I think that finding the right room to be in with inspiring people or leveling up who you're spending time with, asking yourself, is what I'm doing relevant, or what can I be doing that's more relevant to the me I want to be? Joanne talked a little bit about this on the last episode about getting clear and letting go of what's no longer serving you, because that's how we stay stuck in a rut. And I was stuck in a rut for the first 2 decades of my career. And then I got unstuck and I haven't stopped since. And I continue looking for those rooms that are going to inspire me, lift me up, keep me moving. I said to Joanne this morning, as I was so late getting ready for the podcast, and I just thanked her for allowing me to be myself and for helping me be the best version of me. And part of that was I knew I didn't need to stress myself out, because Joanne cares enough about me as her friend that me running late, which is not necessarily out of the norm, is a forgivable offense. And I chose Joanne back in 2020 at a mastermind. I chose her as one of my people. And I don't know where I'd be without that. My life is so much more fulfilling, and I've met so many amazing people through her. And that was because I chose myself to say yes to coaching and to becoming somebody who goes to masterminds and personal growth and development. And that continues to have a ripple effect.
I'm going to get all emotional here because it has been a journey, and it's been nice making the investment, and not just financial, but in terms of our responsibility and time to move forward, to go to these conferences and to be with the right people, the people who will push you to be better and support you and love you for who you are. And those spaces exist everywhere. We just need to find them. And I love, again, kind of thinking about the being a physician disruptor, whether it could be someone who's very loud, or then the one who just leaves notes quietly in someone's desk. That's also how we create change, and the importance of being in alignment to know what's important and to know what we need, and know how we can create change and how we can support each other. And yes, we're done with thinking that it's not our time. We're done waiting. We're done just managing. It's time to step up. And I hope that this episode was as inspiring to you as it was for me, just listening to Erin and again walking the talk. Erin, and I know that we can keep on talking about all the wonderful things, but is there anything else that you would want us to know? Any other nuggets to add?
One of the words we haven't talked about yet, and I think this is a topic for an entire episode, is psychological safety. And when I was at the Dr. Lorna Breen Heroes Foundation, when I was at the writing retreat, those words came up a lot, and it was more the lack of psychological safety. And one of the things that Joanne and I have both become experts at is creating spaces that hold psychological safety, where it's okay to be you, where we're not going to have judgment, where we can be ourselves, where we can be a human being and a doctor and a mom and a partner in a safe space. And Joanne and I have shared, we both have retreats. We've both got retreats coming up this month as well. And they're an ongoing part of what we do. If you don't have a space to have psychological safety, reach out. That's something that we are great at finding and creating, because that is an important component of being in the right room, is for you to have that psychological safety.
That sounds so important. Thank you for bringing that up. And also, if you are curious about coaching, if you're ready to take that first step, click the link in the show notes to join the waitlist for a small group session with Erin and me. And with that, stay tuned because our next episode is coming right up.
Do you want exclusive resources and the opportunity to connect with us? Then visit createmeaninginmedicine.com now, where you'll dive deeper into how you can create meaning in medicine. And if you're serious about optimizing your results, take 2 quick steps now. Connect with us on the website and tune in to the next episode.